Namaskar, welcome to PKS classes. Today we will study the chronopharmacology of anti-ulcer drugs. As you know, chronopharmacology is the study of effect of dosing time based on circadian rhythm. So effect of the dosing time on the dynamics and kinetics of a drug is called chronopharmacology. So circadian rhythm is the biological rhythm which occurs every 24 hours. So about a day, Dian is day and Circa is about a day, whatever biological rhythm occurs. And in context of peptic ulcer, the anti-ulcer drugs, one is acid secretion, and acid secretion peaks in the night between 10 p.m. to 2 a.m. So if we can target this acid secretion during this period, then the drug will be more effective. Second, the gastric emptying rate, mucosal blood flow, they are slower at night as compared to day. Then cortisol peaks in the morning around 7 a.m. and cortisol has anti-inflammatory effects which helps in gastric mucosal healing. And another one, the immune system, between 2 a.m. to 4 a.m. there is peak lymphocyte level. So in the morning the immune response is more, and for that reason we can use the antibacterial drugs during that period. So this is the theory for chronopharmacology of anti-ulcer drugs or chronotherapy of peptic ulcer disease. So before discussing that, let us know the pathophysiology of ulcer. And ulcer occurs when there is more mucosa damaging mechanism as compared to mucosa protecting mechanism. And what are the mucosa damaging mechanism? Acid, pepsin, and the bacteria Helicobacter pylori. For more details you can refer to our earlier classes on peptic ulcer. And mucosa protecting mechanisms include mucin, bicarbonate, and the prostaglandins. So the acid is secreted from the parietal cell of GIT, and there can be one cell hypothesis or two cell hypothesis. So if only parietal cell is considered, then it is one cell hypothesis. If we consider mast cell as well as the parietal cell, then this is two cell hypothesis. As per the two cell hypothesis, acetylcholine and gastrin acts on the specific receptors present in mast cells to release histamine, which histamine now acts on the parietal cells to secrete acid, gastric acid, that is hydrochloric acid. And as per the one cell hypothesis, acetylcholine by acting on the muscarinic receptor, histamine by acting on the H2 receptor, and gastrin by acting on the gastrin receptor of the parietal cells secrete acid. And for the acid secretion mechanism, there is involvement of one is proton pump or H plus K plus ATPase enzyme, and the other is the potassium chloride co-transport. So proton pump secretes acid in exchange of potassium, and here energy is utilized because this is active transport acid is secreted from the parietal cell into the lumen. So from low concentration to high concentration, active transport occurs. So there is use of this ATP. ATP is hydrolyzed to provide the energy, and potassium chloride co-transport supplies the chloride. So H plus Cl minus, that provides the gastric acid or HCl. So based on this, we have drugs like H2 receptor antagonists. They act here, and muscarinic receptor antagonist, they inhibit the actions of acetylcholine. Then so we can say that acetylcholine, histamine and gastrin are the positive regulators of acid secretion, whereas prostaglandin is the negative. Prostaglandin E2 is acting on the prostanoid receptor, is the negative regulator of acid secretion. So we can use the prostaglandin analogs here. Then we can use the proton pump inhibitors. And to neutralize the acid for symptomatic relief, we can use the antacids, which have mainly the hydroxide ions or bicarbonate ions, which act with H plus ions to provide water mainly. So they neutralize the acid. So antacids can be used. Then we can use the mucoprotectives, which protect the mucosa surrounding the gastrointestinal lumen. And so mucoprotectives we can use like sucral fat are used as mucoprotectives. Then, as we said, that in Helicobacter pylori, which lives inside the mucosa, and it itself does not cause the acid secretion, or it itself does not damage the mucosa, but the immune system, which is activated against the Helicobacter pylori to kill the bacteria, actually damages the gastric mucosa. So initially there will be gastritis, inflammation, which on chronic becomes ulcer. So we can use drugs against this bacteria. So antimicrobials or antibacterials, or even antibiotics we can use, which can kill the Helicobacter pylori. So these are the drugs. So when we will discuss the chronopharmacology, so we will discuss them in respect to the circadian rhythm. And as we have discussed that acid secretion peaks around 10 p.m. to 2 a.m. in the night. So the H2 receptor antagonists, which are used once daily, like famotidine, this is used once daily. We can, and drugs like ranitidine, which is used twice daily, is having no chronopharmacological relevance. So we are discussing here those H2 receptor antagonists which can be used once daily, like famotidine, very safe drug. So they can be used at the bedtime. So if they are used at the bedtime, then they will be most effective. So H2 receptor antagonist should be used at the bedtime. And for those people who suffer from constipation due to acidity, for them also this is a beautiful drug, excellent drug. Then regarding proton pump inhibitors like omeprazole, lansoprazole, pantoprazole, they can be used either in the morning or evening, and mostly they are used at the morning before breakfast. So if it is used in the morning, it can provide daytime protection against acidity, and if it is used in the evening for nocturnal acid suppression, we can use them in the evening. Then the antacids, they actually provide the symptomatic relief. They neutralize the acid H plus. So H plus plus OH minus becomes water. Similarly, H plus plus bicarbonate gives water and carbon dioxide. So they provide symptomatic relief. So they are usually used after meals, and they can also be used at bedtime for better action. Then sucral fed, the mucoprotective, it should be used at bedtime because it creates a protective coating on ulcers and enhances healing. Because we have studied just that the gastric emptying rate and mucosal blood flow is slower at night. So if we use them, then it will have better action. Sucral fed, if you use at bedtime, it will have better action. Then the antimicrobials, the antibacterials, the antibiotics which are used against Helicobacter pylori, like amoxicillin, then the metronidazole, tinidazole. These drugs, they should be used in the morning because it aligns with the body's natural pattern of immune response and gastric motility. So they can be used in the morning if used once daily. But if it is used multiple times a day, then they will have no chronopharmacological relevance. So out of all these drugs, the most relevant as far as chronopharmacology is concerned, that is the H2 receptor antagonists, and among them this famotidine, which is used once daily, should be used at the bedtime. So that's all about the chronopharmacology of anti-ulcer drugs. Thank you.